I'm going to see if I can advance these slides. There we go. Okay. So during this webinar, I'm going to show you several things. I'm going to talk about our three-step process. I'm going to talk about where the cells come from, how they work, what they can do, and answer your questions. A little bit about me. I'm a physician. I'm trained in physical medicine and rehabilitation. I have special training in these regenerative procedures. I'm a Regenexx physician, but I'm also a repeat Regenexx patient. And the goal of undergoing Regenexx treatment is to allow me to do the things that I really love. As you can see, I'm a cyclist, and that's very important to me. And then we have my associates, Dr. Adelsheimer on the left and Dr. Sally on the right. We're all board certified physicians in physical medicine and rehabilitation. We all do Regenexx procedures. We have 5 locations, including Pittsburgh, which is our main location, where we do the procedures, but also Monroeville, Bridgeville, Washington, and Sewickley, where we have offices. We've been part of Regenexx since 2012. And we'll talk more about Regenexx as I go along. We've done over 2,500 stem cell procedures and 10,000 platelet-rich plasma treatments over the course of the years. We treat you from the initial evaluation to the end of your treatment and your follow-up care for the years following your treatment. You get us, physicians, specialists, experts. We don't pass you on to a nurse practitioner or a physician's assistant. And Regenexx is a solution to a problem that exists. Traditionally, people have undergone pharmaceutical treatment or steroid injections, gone on to physical therapy and chiropractic care. And when that doesn't work, they have surgery. In this instance, Regenexx is the treatment solution that spans the gap between traditional conservative care and surgery. And it's important to know that there's really not much evidence for what is done in orthopedic surgery today. About 20% of orthopedic surgery procedures have undergone research scrutiny. Most have not. A lot have been shown to be ineffective when compared to sham surgery or placebo. So that's an important thing to note. Not all of these surgeries work. The one that has been shown to work is carpal tunnel surgery, but we treat that as well. And there are more risks associated with surgery than there are with the treatment that we do, including heart attacks, strokes, nerve damage, infections, blood clot, and death. These are not problems that we encounter, but they're encountered a fairly significant amount of time from orthopedic surgery. So with regenerative treatment, what we're trying to do is stop things from being cut out. A great example would be a meniscus surgery of the knee, where the part of the meniscus is removed, and as a result, the stresses occur in the knee from abnormal movement that wears the knee out prematurely, and you head to a total knee arthroplasty. So rather than get a joint replacement, better to inject biologic agents. And they're your stem cells and your platelets to help the tissue heal. So Regenexx is a highly selective physician network. We've all been extensively vetted by the parent facility in Denver. We use proprietary high-dose stem cells and platelets from you. We are the world's leader in research and development of this treatment. And we also have a nationally self-funded employer program. So some of you out there may have employers that participate in Regenexx treatment being available to you, and you may want to check that out. And this is a great slide because it shows what it's like to undergo Regenexx treatment. This fellow had meniscal treatment and treatment of his anterior cruciate ligaments in both knees. And there's just a little Band-Aid there, and he recovers. There's much less downtime, shorter rehabilitation. You take much less drugs, and you're back to work in days, not weeks. And for many of these procedures, you can be awake. We do have the option of sedating you if you want, and we often will use a nitrous oxide sedation to help you with the procedure. And we treat everything, everything that's musculoskeletal. We treat from your temporomandibular joints in your jaw down to your big toe. We treat spine problems all day, every day. Disc protrusions, sciatica, ruptured discs, spinal stenosis, all the time. We treat knee arthritis every day, preventing people from undergoing joint replacement. We treat anterior and posterior cruciate ligament tears. We treat shoulder arthritis, rotator cuff tears, tears in the labrum. Same thing is true with hips. We treat arthritis. We treat osteonecrosis, which is dead bone. We treat labral tears, tendon problems, and we're a joint replacement alternative, as we are in shoulder surgery. In the ankles and feet, we treat Achilles tendinopathy, arthritis, instability of the ligaments, plantar fasciitis. You name it, we treat it, and we treat it a lot. So interventional orthopedics, we throw the knife out the window, hopefully not to hurt anybody, and we use needles for the care that we provide to you. We're using your own cells to reduce your pain, improve your function. We're using your own platelets and a bone marrow concentrate. And we can reduce the need for orthopedic surgery about 70% or more of the time. There's a great study that we've done that shows after 2 years, the incidence of people who were told that they needed a knee replacement actually undergoing it is 13%. 87% of the people have been satisfied with the regenerative treatment using their own stem cells and continue to do well. So this is a new medical specialty, interventional orthopedics. We use precise needle-based procedures using ultrasound guidance or radiographic guidance with an X-ray, fluoroscopy. It's much less invasive. And again, we're avoiding more invasive surgeries. And this is what it looks like, a procedure room with the ultrasound on the right, the fluoroscopic C-arm on the left, the monitor, and we do monitor your treatment with blood pressure, heart rate monitoring often, period. So this is what our lab looks like. We do concentrate your cells under a special hood that's sterile, and we give you the concentrations of stem cells and platelets that you need to get the job done for you. And these are platelet-rich plasma products from your blood. We've removed the blood because we find that without the blood, these platelets work better and they don't hurt as much. So some examples of orthopedic surgery, of interventional orthopedics, not orthopedic surgery. Treatment of the anterior cruciate ligament. We do provide this treatment, and we can treat the bundles under X-ray guidance, and there's a way to get the cells to flow along the ligaments, and we can heal ligaments that have tears in them of 1 centimeter. This is an example of treating a slap tear in the shoulder, where we're filling in the slap tear and treating the shoulder joint at the same time. This is an example of somebody who has what's called a bone marrow lesion, and we can fill that in while treating the joint at the same time, using the patient's own bone marrow concentrate to obtain their stem cells. And finally, this is an example of treating carpal tunnel syndrome with an itsy-bitsy needle, where we're doing something called hydrodissecting, which is a fancy term for freeing the nerve up from the tissue around it. And this does a surprisingly good job of treating carpal tunnel syndrome without surgery. Lastly, rotator cuff tear on the left. You have a 1.2 centimeter separation of the supraspinatus, which is the main muscle tendon of the rotator cuff complex. And on the right, 6 months later, after using the patient's own stem cells, that tissue has healed and the patient's doing well. And this is Julie, one of our patients who became one of our employees. She had dead bone, and you can see that on the left in that hole. Surrounding tissue is problematic. She was on crutches for 3 years, couldn't weight bear. They said she was too young for a knee replacement. And on the right, the hole has gotten much smaller. Her pain has gone away. She's fully functional. She's back to work. She's back to life. She's a yoga instructor, and she is one happy lady. So how does regenerative medicine work? Let's talk about PRP, platelet-rich plasma first. You can think of this as growth factors. It contains growth factors, and it also helps amplify healing. PRP is like an espresso shot for local repair of cells. It attracts stem cells into the area. It quiets the pain down from an injury, and it makes the cells work harder and longer to get your damaged tissue repaired. Stem cells are the general contractors to repair the job. They tell other cells what to do. They work in conjunction with PRP to work synergistically. They work better with PRP in the area. And the stem cells can also become brick and mortar. They can become cartilage producing cells, tendon producing cells, bone producing cells, ligament producing cells. If they're put where the damaged tissue is, they become those tissues. And we're using your own cells. We're not using anybody else. We're not using embryo, amniotic cord blood. This is an FDA compliant treatment, and it's the only FDA compliant treatment. So which one is for you? PRP is generally for smaller joints, less severity ligaments, tendons, and about 99% of what we do in the spine is with platelet-rich plasma. Bone marrow concentrate derived stem cells for larger joints where there's more damage, more arthritis, more severity. And if you have lesions like Julie did in the bone, this is the treatment for you. About 50% of what we now do is platelet-rich plasma, 50% is stem cells plus platelet-rich plasma. And not everybody needs stem cells. We can save you lots of money by doing platelet-rich plasma, there's a significant cost difference. So the pre-injection, this is what we refer to in farming terms as tilling the soil. We're getting things ready for the implantation of your stem cells. We strengthen and tighten ligaments with a dextrose-based formula. We stimulate inflammation to rally your body's immune system into the area and take full advantage of a stem cell injection. We then harvest bone marrow from your pelvis, put your hands on your hips, put your fingers forward, put your thumbs in the back. If you feel those bones in the back, they're not your spine bones, they're your pelvic bones, and that's where we get the stem cells. And that's the source. I've had it done to me, doesn't hurt. Mild ache when you're withdrawing the bone marrow concentrate. We put it back to you in the same day, usually within 2 hours, and you go home. And the stem cell injection is planting the seed. We've talked about the bone marrow aspiration. Usually this occurs 2 to 4 days after the pre-injection. The aspiration is pretty mild. The pain goes away very quickly. We send it to the lab for processing. We can count your cells. We know how many cells we've gotten, how alive your cells are, and re-inject you about 2 hours later. And then finally, there's a third treatment, which we say is fertilizing the stem cell seeds, where we get platelet-rich plasma from a blood draw. Usually this occurs 2 to 4 days after the stem cell implantation injection. And again, we send it to the lab for concentrating. We re-inject it. And everything that we do under guidance, including this last injection. And everything we do as physicians. You don't get physician extenders doing anything. As far as Regenexx goes, we have done the most research of any entity in the world. We have a registry, which is the largest in the world, containing 34,000 patients being followed to see how they're doing. And they answer questionnaires, and we make certain that they're followed and that they are satisfied customers. We've published 29 peer-reviewed papers on platelet-rich plasma, but primarily on bone marrow-derived stem cells. We have ongoing clinical research, randomized controlled studies. We have one on rotator cuff, one on anterior cruciate ligaments, and one on the synovial fluid in knees. And we have outcome tools. We want to always see what's possible. If something in the world changes and it's significant, you can bet that we will look at that. Usually we're the ones who make the changes in the treatment protocols from the research that we do. We have the world's largest paper, 372 patients, 0.2 or 0.17% had what were considered to be significant events, compared to standard orthopedic surgery, where 6% of the patients have significant adverse events. So much more safe, needle-based compared to scalpel-based treatment. We're trying to stack the deck in your favor. You get the best doctors, you get imaging all the time, every time, either ultrasound, fluoroscopy, X-ray, or a combination of both. We've done the research, we have the best safety, we provide personalized medicine. This is specific to your needs. It is not the same, it is not one size fits all. Concentrate the cells specific for you and your needs. We evaluate you, we determine your candidacy. Not everyone is a candidate, and we try to be transparent and tell you the cost up front so there's no surprises. Who is this for? It's for people who want to avoid surgery. You want to keep all your body parts. Don't forget, when you're getting a joint replacement, you're getting a joint amputation. They're cutting your joint out. If you don't have time for a lengthy rehab, you don't want drugs, you failed surgery before, you're too young for surgery, Regenexx treatments are for you. We want you to get your life back. It's important from the standpoint of being involved with your family, enjoying your life. Your finances are important, getting you back to work as quickly as possible, improving your fitness, and improving your relationships. If you were in pain, your mood is not going to be as good as if you're out of pain, and your relationship will suffer. Generally, we have good outcomes. As I've said, we have less pain, increased function, improved mood, you're off your pain medications, and you're back to your preferred active lifestyle. For the next step, there's no referral necessary. Gather your imaging, MRI or X-rays, call the Regenexx liaison. We'll talk about that at the end. Go to the appointment or make a telemedicine appointment. We'll order the imaging that we need. If you don't have it, we'll do an ultrasound evaluation of many areas of the body except for spine. If you're a candidate, get the treatment, have the rehab at home or physical therapy, and get back to your life. So the first step is make an appointment with one of our physicians after you've gone through the liaison. Again, we're all physician specialists. We have been board certified in a physical medicine rehabilitation, and we have gone through lengthy training through Regenexx several times per year. We are all experts in our program. We've attained the expert certification from the Interventional Orthopedics Foundation, which is associated with Regenexx in all areas. So spine and all areas of peripheral joints. Every one of our doctors has attained the expert level of training. Finally, we use imaging for everything that we do. This provides precise treatment to the area that's damaged, but also it lessens the chance of any sort of risk for you. We're making the right diagnosis to provide you with the right treatment every time we see you. Second treatment is to get an examination. This is an extended examination, usually approximately an hour. We're going to do that ultrasound exam, and we're going to answer your questions. We're looking at stability, both from a functional standpoint during the exam, but also under ultrasound. We're looking at the articular surface and the articulation to see how damaged it is. We're looking at your neuromuscular system, because if nerves are involved and their function is reduced, your joint and your muscles will be affected because of it. An example would be somebody with an Achilles or plantar fascial problem is likely to have a smoldering S1 radiculopathy, like a sciatica coming from the back, so that they have that plantar fasciitis. Finally, we're looking at symmetry, the balance of your body from stem to stern, from foot to your neck, and attempting to repair asymmetries. A great example would be someone with scoliosis of the lumbar spine. We will attempt to correct that with the treatment that we do. Third step, get treatment. There's little to no rehab, minimal to no pain medicines, minimal to no missed time. You're getting your life back sooner than later. So get the treatment. You'll be happy with the results. We want you to take your health off hold today. Don't don't wait. It's important not to wait. You're going to avoid the surgery backlog and a worsening of your condition. You're going to get your fitness back. You're going to reduce your weight as a result of your improved fitness. We're going to improve your quality time with your loved ones. And no one is getting any younger. You may be a candidate for stem cell treatment today, but if you wait 6 months, that may not be the case. I can think of a great example of somebody who had a knee, knock-knee problem. When we first evaluated her, she was just on the borderline of what was possible. When we evaluated her 6 months later, she had toppled to the point that she was outside the range of what we could help. So don't wait, get this done. Finally, financial information. Insurance most often covers the consultations, the follow-ups, the diagnostic studies that we order, the bracing and the therapy. It doesn't cover the regenerative procedures that we've talked about. But with copays and deductibles, you may actually be paying more for traditional orthopedic surgery. And again, we're customizing the treatment for you, so there's a wide price range involved. Contact Sarah Ferland for a new patient evaluation. She is our Regenexx liaison. You can reach her at 412-963-6480, and she will be happy to get you scheduled. And if you schedule and you're part of the webinar today, and you go on to have a procedure with your own bone marrow concentrate containing your stem cells or platelet-rich plasma treatment, there will be a substantial savings for those treatments based upon your having participated in the webinar. So don't wait. Regenexx, avoid surgery, reduce the downtime, get back to your life. So I'm going to see if I can figure out who's here. We have some participants, and I will try to answer the questions. Does anybody have a question at this point in time? I'll be glad to answer your questions. Or have I dazzled you all? I'm going to take this off. Let's see if I can take this off mute. Maybe we can have a discussion. So I can hear you now. If you have any questions, I'd be glad to discuss them. Otherwise, I'll wait a few minutes and you can let me know. So I want to thank you for participating tonight. I've obviously dazzled you, and I appreciate your time, plenty of time to get to the Steelers, and hopefully you'll consider us for your regenerative procedures, and you'll be able to avoid surgery and go on to have an excellent recovery, swift, get back to doing what you love to do. It's what I do. I've had these treatments, and I do understand how quickly you can get back to a recovery. Anyhow, thanks for participating, and best of luck. Hope to see you soon.